Other things that can regulate breathing rates are those stretch receptors in the lungs. This is called the Hering-Breur inflation reflex or deflation reflex, and it's really a protective reflex. It prevents your lungs from changing size too much. So this is what happens. The phrenic nerve is the nerve from the diaphragm, and it's going to send out a motor impulse, and the diaphragm contracts. And when the diaphragm contracts, the lungs are going to get bigger. So lungs increase in size. And that stimulates a stretch receptor that's in the tissue of the lungs, which is basically smooth muscle around the bronchioles. This is sent through the vagus nerve to the inspiratory centers in the brain, and it basically tells the inspiratory centers to stop inspiring so that the lungs don't overinflate. So it stops the output from the phrenic nerve. There's also a deflation reflex. This prevents alveolar collapse, so you don't want to push out too much air out of your lungs. So if we look at it in this way, basically the stretch receptor here is in the alveolar space of the lungs, goes to the vagus nerve, and now it's inhibiting the expiratory centers and stimulates the inspiratory centers as well, so that you don't let your alveoli collapse. And you also have protective reflexes. These include sneezing. This is caused by irritation of the nasal cavity. Coughing, which is caused by irritation of the larynx, trachea, or bronchi. And there's a laryngeal spasm, which is an involuntary closure of the glottis due to toxins or physical damage.